Welcome to the Alive Pioneer User Guide Supplement Read-Through. We're going to go ahead and read through all of the Alive Pioneer version user guide. And at the same time, we're going to take a look at some of these features in Alive. So here on the right, I have the user guide supplement, and on the left, I have Alive open. If you haven't gotten a chance, first take a look at the Introducing Alive Pioneer features for a quick overview. Also, if you have Alive installed, you can go to the Start menu, Programs, open up Alive, and open up the Alive Pioneer version user guide PDF. And then you'll have open what I have here on the screen. And if you prefer, you can just read through that on your own. If not, we're going to walk through it. Now, before we start going through the Alive Pioneer user guide supplement, I did want to mention one feature that isn't mentioned in the supplement. Once you have Alive Pioneer, now we have three different versions of Alive. We have the regular version of Alive, the clinical version, and the Pioneer version. So if for some reason you have Pioneer installed, but you would like to use one of the other versions, that is possible. You need to open up your hard drive, program files, Alive, and then using one of these BAT files, Alive Clinical, Alive Pioneer, or Alive Standard, you can choose which version of Alive to open. For example, if you wanted to demonstrate Alive Clinical or Alive Standard while you had Alive Pioneer installed. So to go through the Alive Pioneer user guide supplement, we're going to go ahead and just read through the table of contents so you understand what's coming up. Introducing Alive Pioneer, welcome to Alive Pioneer. Then we have a bunch of new Alive Pioneer feedback measurements. So we're familiar with skin conductance. Now we also have an automatically ranged version of skin conductance that we can choose. These feedback measurements are here on the main menu. So from the main menu, you can now choose any of a number of additional feedback measurements, whereas before, in the regular version of Alive, you only had heart rate smoothness, and in the clinical version, with the IOM or light zone sensors, you also had skin conductance. Now you have many new measurements that you can use for feedback. The measurements are SEL automatic, automatically ranged version of skin conductance level. You can now train with average heart rate. And again, there's an automatic and a manual version. So the automatic of each of these measurements means that you can just start training right away. And Alive Pioneer will create a starting and target range for you. So with average heart rate, it's going to be training towards greater relaxation. In most of the measurements, if you use the automatic version, you're training towards relaxation. If you want to train towards excitement, you need to use the manual version. For example, with average heart rate, you would set your target heart rate to be higher if you wanted to train towards excitement or activation. So we have average heart rate, we have BVP amplitude, which we're going to go into in depth later, but basically this is the amplitude of the blood volume pulse measurement. So when we're training with blood volume pulse, we can see not only the actual pulse, but the sort of amplitude. And what happens is that when you get stressed or tense, which I'll do now, the total amplitude of the BVP signal shrinks, and that happens right away, and that can be a very useful training method. In addition, we can train with heart rate range, which some people use as an alternative to smoothness. SEL stability, now this is something that was in the original Somatic Vision software. It's how quickly the skin conductance signal moves. And this is a very easy way to start people off training with Alive or with any sort of biofeedback, because it's very easy to control. If you're relaxed and not doing anything, your SEL is stable, and whenever you have a kind of SEL event, an SEL spike, you see a drop in stability. So it's a good way to start people off, especially if they don't believe that you're accurately reading what's happening inside of them. We have two new smoothness measurements, an automatically ranged smoothness. This is kind of setting the difficulty level continuously to help target your particular ability to achieve smoothness, as well as a manual smoothness, which lets you set a kind of target and starting smoothness. Then we have two very new measurements, arousal and valence, which are basically components of emotional detection. So valence is happiness. These are still experimental measurements. There's no standard way of measuring valence using heart rate or skin sweat, but we have a unique new way that seems to work pretty effectively. So when training with valence, this is basically happiness. So higher valence is any sort of more positive emotion, and lower valence is a more negative emotion, whereas arousal is how activated you are. So for example, a negative emotion that's low arousal would be a kind of sadness or depression, whereas a high arousal negative emotion might be anger or fear. We have many new graphing screens that allow us to train with all of the different new measurements. In addition, we can add graphing screens so that we can have as many graphing screens open as you want, which you can put on secondary or even tertiary monitors, or just arrange them on a single monitor. We can also now hide and show components to make it more convenient to arrange these on a monitor. So we have new Pioneer environments, which are here under live environments. We have many new environments. Each one is designed to train with a certain one of the new Pioneer measurements or one of the standard measurements, such as smoothness. We'll get also more into the Pioneer measurements later. Pioneer measurements can also allow you to train 2 measurements at the same time, using this feedback selected in the main menu combined with, you choose one feedback from the main menu and then you click one here, and you can train, for example, with heart rate smoothness and skin conductance level at the same time. Also, we have 2 user training. If you have 2 IOMs or 2 light stones, or 1 IOM and 1 light stone, you can hook 2 people up at once to just 1 copy of Alive, and they can train at the same time using some parts of Alive. All the graphs work. There are Pioneer measurements dedicated to that. And you can also train with dual drive, with 2 people at the same time. And what that looks like is the cooperative mode, where one person makes the car go and the other person makes the fog disappear, so that together you work to win in dual drive to clear the fog and speed up your car. In addition, now we can record session audio. So here in the clinical control panel, there are some new options. One of them is here, record audio, which defaults to never, but you can set it to always or ask each time, in which case when you're doing a session, you'll have an audio recording of that session, which is synchronized to the graph training. So that, for example, when in progress review, in the clinical single session review, you're reviewing a session, you can jump around to different parts of the session and listen to what you, or if you're working with a therapist, what a therapist said right before, after, or during some kind of event that you see. So if you were training skin conductance, you see a huge spike, you can see what was said right before that. In addition, we now have some background sounds, reward beeps, so we can play a little sound if your target measurement is above 80%. And there's also breath pacer sound options, so you can hear 2-tone indication of when to breathe in and out. That can play at the same time as whatever other music, if you're training with dual drive or an environment, is playing. Now there's a lot of new measurements, and we're faced with having to learn more and having to make more decisions. There's a quick reference right at the beginning of the user guide, right after this table of contents. We have 5 different categories of measurements here. I'm just going to read through. So smoothness, HRV, achieve balance in the autonomic nervous system to stabilize emotions, develop a clear mind, improve attention, concentration, and planning, facilitate acceptance, openness, and a positive emotional state, create and maintain a sense of harmony and well-being. And these are our general guides, but none of this should be interpreted as treatment for any specific medical condition. If you have a medical condition, please see a doctor for a recommendation. BVP Amplitude. BVP Amplitude shows a more cardiovascular kind of stress, cardiovascular, physical, and mental stress, whereas skin conductance level, in comparison, shows a more nervous system stress. If you have a more physical stress, you'll see it a little bit more on BVP Amplitude. BVP Amplitude also helps differentiate bad stress from healthy stress. Some amount of stress does improve performance, whereas too much stress or stress that is too prolonged is unhealthy and decreases performance. BVP Amplitude can also be used to monitor and improve deep relaxation skills. Sometimes you'll see BVP Amplitude is kind of stuck for a long time, very similar to temperature training, and then you'll see a major change in relaxation. Monitor anticipation anxiety, monitor ongoing arousal and vigilance. Use BVP Amplitude as an indicator of changes in peripheral temperature. They're very linked. If BVP Amplitude is initially low and doesn't rise, including BVP Amplitude as part of a course of training is highly recommended. Skin conductance training, which you're probably familiar with, a quick and easy introduction to how thoughts affect body and performance, identify anticipation and performance anxiety, monitor relaxation, and learn to relax or energize. If you're training towards a higher conductance, that's kind of energizing or boosting arousal. Average heart rate. Average heart rate changes more slowly than skin conductance level, so it's a good monitor of larger changes. For people who see significant changes in heart rate when stressed, especially if SCL is not responsive, you can have an arousal-based measurement similar to skin conductance, but heart rate, absolute heart rate changes. Relaxation training to lower heart rate. Lower average heart rate is, of course, a sign of deep relaxation. Lowering average heart rate is a deeper experience of letting go than lowering SCL. Lowering SCL is more of an experience of quieting thoughts. Easy to understand. Everybody knows what average heart rate is. People have heart rate monitors. Practicing raising and lowering average heart rate is one possible introduction for people new to Alive. Then we have our new proprietary and experimental emotion detection, which can more accurately measure things that people understand. Excitement, relaxation, happiness, sadness. So a different way of training for people who want a more intuitive type of training or are working with their emotions. For example, with a therapist, to help teach people to shift emotional states and train them to access emotions that are hard to achieve. Improves access to positive emotional states, or sometimes we practice first accessing a negative emotion and then shifting to a positive emotion, facilitating emotional flexibility. Again, it is experimental, but we find it to be pretty accurate. I'm going to try to skip through parts that I may have already touched on. So Alive Pioneer introduces new ways to train stress, relaxation, and emotional states. All of the measurements are derived from heart rate and skin sweat. Pioneer is designed primarily for the IOM or Lightstone. If you have an emWave, you can use it, but with far fewer measurements. As we mentioned, Pioneer measurements can be selected from the main menu on the feedback selector. This feedback selector only has to do with the standard Alive environment and the Alive games. When you're doing graph training, you choose the feedback based on the graph you choose. And in Alive Pioneer environments, you also choose the feedback based on the environment, because every environment targets one or more specific feedbacks. The training measurements here, how much time everything is used, as well as how well you've done on each item, are stored per measurement. So if you've done a lot of training with heart rate smoothness and have some data there, if you switch, say, to a new measurement, BVP amplitude, that you've never used, you'll see that it shows that you have in fact never used it. So these measurements are specific to the feedback, whereas here your level and your overall training time are for all feedbacks combined. This is talking a little about the individual measurements, which we've gone over, but I'll touch upon it again. SCL automatic. This allows you to train your SCL without having to worry about manually setting high and low values. Let's take a quick look at what that means in practice. So, for example, if you choose skin conductance level, and then you go ahead and choose an environment, before you even get to that environment, you're going to need to set how you want to train. So we have some kind of starting skin conductance level and a target. And when we get to target, then say we're about to go into an Alive environment. In Dreamhouse, for instance, you build a house. So you need to get to your target SCL measurement in order for the house to build. And if you go back to your starting, then the house takes itself apart. So here we set what that means, starting and target, what we want to achieve. But if, for example, you don't want to have to set those, you can now choose some of these automatic measurements. So if you choose SCL automatic, it will be constantly calibrating the SCL. So you'll see more small changes in SCL. If you want to train towards a long-term relaxation, you need to set that goal using the manual version, whereas the automatic version lets you not have to set any starting or target values. But if you get very excited and stay excited for a while, then any kind of decrease in your excitement will then show as full 100% reward. Everything is going great, even if you haven't returned to your starting value. So all these automatic measurements are continuously calibrated. Let's take a look at that in a graph. So here, let's say I'm going to target this SCL down here. So it might take a long time for me to relax, and I relax and I relax, and I get towards my target SCL. Let's even make it easier. But now let's say I have some big event and I have a huge amount of SCL rise. So here, if it's manual, I still need to drop now all the way back down to my original target. Whereas if this was automatically ranged, it might be moving this slowly upwards to help us find out when we are relaxing. So you can take a look by experimenting with the different manual and automatic measurements. Also in the graph training, you can actually see here SCL automatic. You can see what that looks like. See how it is automatically ranging compared to how you would be manually ranging it. That pretty much holds true for all the measurements. Average heart rate, automatic, and then average heart rate, manual. I'll read that one. Average heart rate manual allows you to train average heart rate changes, learn to relax and lower your average heart rate. This may be especially useful for people who feel their heart pounding quickly during stress. Babies and young children have much higher resting heart rates than adults. Athletes and highly fit people tend to have lower resting average heart rates. Using the manual average heart rate measurement, you can train to decrease or increase your heart rate. Recommended for people who have training so they know how to set the low and high values, the starting and target. BVP Amplitude Automatic. We're going to have a whole section on that at the end, but I'll read the manual version. BVP, blood volume pulse, is the raw measurement that is used to determine heart rate in alive. A decrease in the overall amplitude, the vertical range of the BVP, is a strong indicator of bad stress. In other words, when stressed, you will see the BVP signal shrink vertically, which we'll try to do for you. This measurement is experimental, but seems to reflect stress changes of the cardiovascular system, as higher BVP indicates greater blood flow through the fingers. Recommended for trained clinicians only, which I would also interpret as, if you haven't had training with this kind of measurement, please research about it, learn as much as you can, practice it on yourself before trying it with anyone else. And if possible, go to some kind of place that does biofeedback certification and learn more. Heart rate range. As your heart rate smooths, that kind of smoothness happens because your breathing and natural heart rate rhythms are synchronized, and it results in the largest possible heart rate range, or a larger heart rate range. So when your heart rate range increases, it's a very similar measurement to smoothness, and some clinicians train range and smoothness either interchangeably or prefer range for exactly the kind of thing that we would normally train smoothness. But if you prefer to train heart rate range, or want to experiment, or want to just have this graph open in the background as an additional source of information, this is heart rate range. SCL stability sharply decreases during rapid changes in skin conductance level. SCL spikes. SCL stability is recommended as a good way to introduce people to the idea that what happens inside of them is visible on screen. It is very quick to respond and easy to control. Let's take a quick look at that. So here we are with SCL stability, and I just was thinking of maybe snapping my fingers. I get a sharp drop. So it's very easy to see changes in stress. And when you sort of do nothing, it just pops right back up. So this is a good way to start training for people, especially if they can't see the correlation between what's happening on screen and what's happening to them. You just snap your fingers and it drops right back down. I snap my fingers and it drops down because the physical motion of snapping and the sound it makes, any tiny startle or any loud noise, will cause SCL stability to drop for most people. So smoothness, we already talked about it, but now, for instance, if you wanted to, you can go to the smoothness manual graphs and set a target smoothness. So for example, if someone's having a hard time, you could start them with a very small range of smoothness, and then as they were doing well, you could increase the range or increase the target value. Arousal and valence are complicated. They are shown together here on this emotion graph. Arousal, we went over this a little bit earlier, so here you can see it. I'm not sure if you can read all of these emotions, but any emotion can be plotted on a graph where we have X. The X-axis here is valence. Towards the right side of the graph are all the nice emotions, the happy emotions, whereas toward the left side of the graph are all of the negative or unhappy emotions. And then your vertical axis here, arousal, this shows the sort of intensity or activation quality of the emotion. So all of your kind of peaceful emotions are here on the bottom of the graph, emotions that would result in a person not moving much or being deactivated, whereas your kind of activating emotions are high on the graph. So for example, here in the upper left corner, we have all the negative emotions that are activating with greater and greater intensity as we get toward the corner. For example, here we have alert. You probably can't see it much, but alert is a sort of medium valence. It's not necessarily happy, not unhappy, but it's high arousal. You're attentive. Elation, extreme happiness, that's on the upper right corner. Peaceful on the bottom right corner. So this is a relaxing, inactivated, low activation kind of emotion that is also very positive. Whereas an unhappy or depressed sort of emotion would be in the lower left quadrant. Also, you can train directly with either arousal or valence, for example, using any alive environment or game. Now, not all games work with all of the new measurements. So for instance, if you were to choose valence, you would see that you can't use the old version of inner tube and you can't train with tropical heat. Everything that's included within Alive, such as dual drive and all of the mini games and environments, work with any feedback. And over time, we'll be making, for example, tropical heat or advanced media player also work with all of these measurements. But for now, if you roll over something, it may say not available for this feedback if you've chosen an unusual feedback. So for instance, if you wanted to train valence, you could train valence and then train it with dual drive. So a person needs to get happy to make their car move, or to build a house with Dreamhouse, or to make the breath spirals grow bigger. Alive Pioneer secondary graphing screen. By default now, whenever you open an environment, also you get a secondary graphing screen that opens. So here's my environment, and also at the same time, a secondary graphing screen opens. I had chosen valence, and it opened a graph that shows me valence. I could also change that. Maybe I want to see the full emotion graph, or I want to see heart rate range. I can then also add new graphs, and you can have as many new graphs as you want open. If you have two screens, then of course we recommend that you put the secondary graphing screen on the other screen. Using a computer with two screens, two monitors is recommended, so that you can put the game or environment on one screen and the graph window on the other screen. If you don't have two screens, you can either switch back and forth in Windows, or you can resize both and fit them on one screen, however is convenient. Here we have our starting and average heart rate, and here we have our feedback on the left, this alive environment. And then in the bottom corner here, we also see starting and target heart rate. So this is starting and target average heart rate. So the graph on the right and the feedback on the left are showing sort of the same thing. So let's say I take our starting average heart rate here, and I'm going to put the target so that we've already surpassed it. So here we are past our target in the alive environment. Everything is big and beautiful. You're succeeding, and you can see in the slider we're at our target. And then here in the alive secondary graphing screen, we also see the bar is full. So everything responds to how we set our starting and target. So here we are, and we are too high according to our values. We haven't reached our target heart rate around 65, instead we're 70 something. So here in the environment, everything is small, the music is low, and the starting to target heart rate slider is all the way to the red. So everything in a manually ranged measurement depends on where you set your starting and average heart rate, and all of the feedback is together. This blue bar on the left side shows how close you are to target, as does the slider, and as does the feedback within the environment or game. If you're not sure about how to set starting and target values, you may need to study more about the measurement you are training with, or switch to the automatic version of the measurement, in which case you'll be training towards relaxation. All of the measurements have the same sort of options that skin conductance did in a live clinical. So you can press buttons to auto range them. You can see maxes, mins, and average. You can train with audio in graph training. This box is now available for all of the graphs. So this is the skin conductance graph. Now we have graphs that are very similar with BVP amplitude, heart rate range, etc. We have a couple of graphs that aren't part of this kind of set. So these graphs in the middle, these all train one new Alive Pioneer measurement, as does emotion quadrants, but that graph looks quite different. We have a simple automatic feedback graphs, which you can just choose any automatically ranged measurement and train with a large graph of it. And then we have full monitoring graphs, which allows us to train with many different graphs at the same time. This is especially nice for two-user training to watch how much people are in sync with their physiological changes. Also now, because you can add new graphs, you can sort of build a screen that looks somewhat like this, choosing particular graphs and putting them in place. We've already gone over the emotion graphs and full monitoring graphs. Also, you can use full monitoring graphs to help decide which measurements are most useful for training. When you look to see which measurement reacts to a stimulus, or anytime you need to see a lot of information on a single screen, you're aware of them. Pioneer environments. So Alive Pioneer includes new environments dedicated to training specific Alive Pioneer feedback measurements. So there is a scroll bar, and you'll need to use it because there's a lot of these things. So they're separated into different segments. These are automatically ranged feedback. So if you choose one of these, it's like choosing one of the automatically ranged measurements from the Alive main menu. Manually ranged feedback, the same thing, but for manual. So you'll need to set in a secondary graphing screen or right before training your starting and target values. It's useful to have the secondary graphing screen open, which it is now by default in Alive Pioneer, because while training, you'll probably need to change your starting and target values occasionally. Feedback selected in main menu combined with. It's a kind of complicated wording, but what we're trying to say here is that let's say you want to train average heart rate and also train smoothness. So here you could choose the manual or automatic average heart rate. And then in Pioneer environments, you'd scroll down to this combined and you would choose smoothness, automatic, for example. And then you would be training smoothness and average heart rate. So it says, smooth your heart rate to form an hourglass. These are all particle systems. If your smoothness decreases, a box will make the hourglass small and uneven. As you exhale and your heart rate decreases, the particles slow down. The pattern disappears if the secondary feedback selected on the main menu decreases. You can see when you're training that there are two different feedbacks happening at the same time. Simply, in order to make a big, beautiful hourglass shape, you need to have both measurements toward their target values. We also have a couple of complex ones. The actual one called complex trains pretty much every measurement at the same time. And then we have a valence and arousal. So this trains valence and arousal together and tries to give imagery that is suggestive of the emotional state or of the changes in arousal and valence. We also here under the Pioneer environments have custom image sets. You have to add some images to a folder and it will play the images. You can use this, for instance, for a study. You could show some relaxation images, just still images, and then some excitement ones, and take a look at the difference in physiology. two-user training. If you connect a second IOM or Lightstone, and we will restart Alive. Now what happens is that you are able to train two people at the same time. So for example, here in the full monitoring graphs, so you now see two lines, user 1 and user 2. To figure out who's who, someone has to remove one of their sensors. You remove one, it says user 1, finger sensors not connected. So now you know who is who, whoever just removed them. They are user 1. And user 1, as you can see, is the orange line. So here, for example, you could watch to see how a number of different measurements, valence, skin conductance level, BVP amplitude, average heart rate, smoothness, how they change. Right now, some of this is changing together because this is my left and right hand, but this is meant for two different users and either watching them change together. It could be used for counseling a couple. Also, some people use it for client and therapist. They're interested in having the therapist mirror some of the client's emotional changes. Also, you can train, as I mentioned, in dual drive, plus the Alive environments. When you open up the Alive environments with two sensors connected, the very top section, which isn't there if you only have one sensor connected, says two-person training. And if you choose one of these, it will train both people at the same time. In the main menu, when you're choosing a user, right at the beginning, if you have two sets of sensors connected, and this has to be two sets of wild-defined sensors, it can be one IOM and one Lightstone, or two of any kind, it should say here, two sets of wild-defined sensors connected. That way you know you've got it right. So I'm going to go ahead and disconnect the second sensor and restart Alive. Recording session audio. So here in the clinical control panel, we can choose to record audio. For example, record audio always. And now let's say I'm going to do smoothness training. How about just regular? So now let's say I'm training smoothness and I have an audio recording of the session that's being recorded. It's good to test this at first to make sure you have your microphone configured properly. But for example, I could now add a comment, but instead of adding a comment, I could simply say, okay, now I'm going to try relaxation for 10 seconds. Or you could be listening to an actual session where there was a client and therapist working together, and you could listen to what the client had just said before a major change, or what the therapist had said. So once you stop the session, you go to main menu, progress review, and you choose the session you just trained. Now you have to then click clinical view to see your audio recording. So the audio recording appears at the top. So once you're playing back the audio recording, you can scroll to any particular part and you hear what was said at that time, and you see here these red vertical lines that show you what was happening with the various measurements that we review at that time. We've talked a little about breath pacer sounds, but basically you can experiment with this, changing the background sounds. Not all background sounds will sound good with all music, so that's why we have different possible pacer sounds, which you can try. So basically what that sounds like is as the breath pacer reaches its bottom, when it hits the bottom and you're supposed to breathe in, you hear a sort of higher pitch sound, and then as the breath pacer gets to the top and you're now supposed to breathe out, you hear a lower pace sound. When training with background sounds, I'm just reading here from the manual, when training with background sounds using Alive environments or mini games, you may wish to turn off the normal background music by selecting the mute music option. And also I just want to note here, the new Alive environments all use the same very long background audio, but you can select any audio for any environment in the music option. Let's say we open one of these Pioneer environments. Under music options, I can choose any piece of music I want, and then I will be training with that music. I can mute the music, or I can reset to its default music. The next part of the user guide is choosing a feedback measurement. Now we've seen this near the beginning, the quick reference, Alive Pioneer measurement quick reference, which talks about when to choose a sort of category of measurement, to use smoothness versus BVP amplitude or emotion. But we get into more detail here in the three-step process, choosing a feedback measurement. So in step 1, you select a category of feedback measurements: smoothness, SCL, BVP amplitude, and motion. So here in step 2, you then choose a specific feedback measurement. So for example, in smoothness, when to train using the original smoothness versus a manually ranged smoothness or automatically ranged. So it helps you choose which particular feedback measurement from the list. Or an average heart rate, am I going to train manual or automatic? And here also you learn a little bit more about manual. For instance, you can train towards relaxation by setting a target average heart rate about 5 to 10 beats lower than your starting value. So once you've chosen a specific measurement, you move on to step 3, which is choosing the feedback or the measurement display. For instance, if you've chosen any sort of automatic feedback, then you can choose between the Pioneer environment dedicated toward that feedback. You can train with any environment or game, or you can view a graph, and in the graph you can view both the automatically ranged version and the manually ranged at the same time. Reading over these 3 steps can help you decide what to do. Should I train, here in the last section, should I train with a graph, environment, or game? Graphs are good for displaying a lot of information. Choose a graph for people who need to see more information, are overwhelmed by everything happening in the environments, for skeptics who have a hard time seeing the connection between their internal state and what is shown in Alive. Graphs are not good for people who fixate on them and get stress or performance anxiety. So some people, when they're doing graph training, they feel like they're being tested, and it can make it harder for them to relax. They may need to see something more abstract, like an environment, and you may want to hide the graphs while looking at the environment. Environments, for example, to continue reading, are the most relaxing display for most people. If you are just starting training or want a training that helps you relax now, choose an environment. Some kids may find environments boring and have more success training with games. It's generally a good idea to start new users with environments. Minigames are similar to environments, but they introduce an additional element of stress. If you are not doing well, you lose your progress. For example, the house that you were building gets taken apart. Games introduce additional stressors, such as competition, time pressure, as well as the optional challenge of manual steering. The additional challenges of minigames and games allow people to practice staying relaxed under pressure and ensure skills can be accessed in difficult life situations, so that they learn to relax not only while in some kind of beautiful live environment, but during a stressful situation. The next section, Clinical Training Guide for BVP Amplitude. I'm going to read through this just verbatim, but you could take a look at it here on the right side. What is BVP amplitude? To determine your heart rate, Alive watches the changes in blood flow in your finger. These raw changes in blood flow are called blood volume pulse. Each time your heart beats, there is a period of time where there is more blood in your finger, followed by a decrease in the amount of blood in your finger. This is used to determine your heart rate for each beat. The overall change in amount of blood flow, the minimum amount compared to the maximum amount over a few seconds, is called your BVP amplitude. When you experience certain kinds of stress, the blood flow to your hands and feet decreases, decreasing the BVP amplitude measured in your finger. The science of measuring BVP amplitude. BVP is measured by a single optical sensor, a photoplethysmograph, or PPG, which senses changes in the perfusion of the blood through the tissue underneath the sensor, due to the amount of light transmitted, diffracted, and reflected through the skin. These changes are influenced by a few factors: vasodilation, widening of the blood vessels due to decreased sympathetic arousal and increased parasympathetic arousal as the person relaxes, or the opposite, vasoconstriction, narrowing of the blood vessels due to increased sympathetic arousal. Changes in the elasticity of the vascular walls, changes in blood pressure. So these are some of the influencing factors for the changes in BVP amplitude. Ensuring a high-quality BVP amplitude signal. The PPG sensor and BVP signal are vulnerable to artifacts. In order for the calculation of the BVP amplitude to be precise, you must minimize movement, especially of the hand with the sensor attached. Complete continuous contact of the sensor with the finger must be ensured. If the fingers are small, thin, or narrow, such as in children or petite adults, small adults, try recording from the thumb. Any movement of the sensor over the skin creates numerous artifacts, which we try to filter out. In most cases, the movement artifacts appear as sharp changes in the raw signal. Alive tries to minimize the appearance of these artifacts, and we also color them red. Setting a comfortable room temperature is important, as low external temperature will induce vasoconstriction. The amplitude of the blood volume pulse signal decreases when your fingers are colder, and that also makes it harder for us to read the blood volume pulse signal. Good readings also depend upon skin quality. Very thick outer skin or dirt on the skin will make it difficult for light to penetrate or be reflected. BVP amplitude is not an absolute measurement that can be compared between individuals. Changes over time for an individual, during or in some cases between sessions, are what is relevant, mainly during a session. Prior to training, clients should avoid alcohol as it will increase vasodilation, and avoid nicotine, which increases vasoconstriction. Therapists should be aware that prescription drugs also have diverse effects on blood volume pulse amplitude. Possible applications for BVP amplitude feedback. Often the constriction of peripheral blood vessels is related to old evolutionary defense mechanisms geared to protect our inner organs or prepare us to fight or flee. Changes in BVP amplitude can be slow or very rapid depending on the state of the client. Rapid changes may result from changes in arousal levels due to thoughts or emotions. Longer BVP amplitude recovery rates, low amplitude for a long time, may be an indication of being captured, stuck and absorbed in an emotion or thought. You can explore changes in blood flow as indicators of hypervigilance or deep relaxation. Fear may cause a sharp drop in BVP amplitude, as shown in the image below. Here, we have very changing BVP amplitude, this orange line between the starting and target. But you see after this fear event, we get here in the kind of 1, this marker here, in this red area that we've highlighted and magnified. We have a marker after which we show an immediate drop, a slight rebound, and then a sustained drop in BVP amplitude over many minutes. So you see this is a long session between the 16 and 20 minute marker. We have a very decreased BVP amplitude compared to the rest of the session, which had more variation. And this variation you see during the session is just due to normal changes in stress levels. Very similar to SCL, BVP amplitude is very reactive. BVP amplitude training can be used instead of finger temperature training when a finger temperature sensor is not available, such as in Alive, where we don't have a finger temperature sensor yet. That may change by the time you listen to this. Peripheral hand temperature serves as an indication of the level of autonomic arousal. A decrease in blood flow reaching the fingertips happens when there is sympathetic activation. So, as you relax, your hand should warm and the BVP amplitude should increase. BVP amplitude changes more quickly than finger temperature, making it easier to see when stressful events start or detect when you begin to relax. And for that reason, if you're training finger temperature with another system, and the client is having a hard time or you are having a hard time changing your finger temperature, you may wish to start with BVP amplitude training because you get quicker feedback when you relax. If you do hand warming using temperature feedback with a different device, the process of warming the hands can be aided by also using BVP amplitude training. Learning to increase BVP amplitude to improve circulation to the periphery and improve self-regulation may be done using the following steps, similar to traditional hand warming. Begin by sitting comfortably on a chair and be sure that the room is comfortably warm. Find a safe environment and adopt an attitude of passive attention. Warming hands can't be done in an effortful manner. Let go, relax your muscles. Begin with 3 or 4 minutes of deep, slow breathing, and let your muscles relax more and more. Then think back on your life, remembering a very pleasant memory and imagine reliving that experience. Feel the warm sensations of your out-breath and focus on the warm sensation where the air leaves your body. Bring attention to your hands and allow more and more blood to move into them. Your hands are getting heavier and heavier. Visualize your heart pumping more and more blood up your shoulders, down your arms, down the forearms, and let this flow reach your fingertips. Feel the pulsations. Continue for a few more minutes and then review the changes in BVP amplitude. This image is a positive example of that exercise we just read. And as you can see, over time the BVP amplitude steadily rose. Since rapid changes in the BVP amplitude may indicate an emotional response or a reaction to cognitive stimuli, BVP monitoring is useful in psychotherapy. This image shows the client's reaction to remembering a painful memory and expressing it aloud. Note the large drop in BVP amplitude near the end of the session. So this person, if you see, had a very near 2000 reading for BVP amplitude during most of their session. When they started addressing a difficult topic, you had a huge drop in BVP amplitude, which you can see here in the orange line, and also this blue is showing the BVP for each beat, the raw BVP, and you see this gigantic drop to near zero here in this area. Using BVP amplitude for dyadic two-user biofeedback in therapy shows the interpersonal influences and may help the therapist tune in and be more empathic to the client. In this example, the therapist and client are both being measured during therapy. The therapist, the higher blue line, relaxes as he listens to the patient's positive memory, but the patient, the lower orange line, is not emotionally engaged with the therapist. Only near the end of the session does he become engaged. And you see here the therapist's higher, which it could always be higher, but also sort of non-linked BVP amplitude to the client. So the client has this lower BVP amplitude, which is constant. And here you can see near the end of the session, the client has a dramatic increase in BVP amplitude. And the therapist has a constantly changing BVP amplitude that isn't really related to the client's changes. So what you'd like to see is perhaps more synchronization between the client and therapist if you're trying to have the client feel more empathized with, or like the therapist is on the client's side. And we have some references. This whole section was written by Yuval Oded, who is just completing and publishing research on BVP amplitude training, and was the inspiration for this measurement to be added to Alive Pioneer. And it is really one of the primary new measurements in Alive Pioneer. Very useful to train with. So thanks for listening to my read-through and commentary on the Alive Pioneer version user guide supplement. I hope this has really helped you learn about all the new features of Alive Pioneer and how you can use them.